We're going to get the message over to Dr. Tedros. In the meantime, Richard, I'd like you to start if possible. Today's announcement, of course, is significant progress, not just towards raising money, of course, but also towards building up our supply of doses for 2021.
Great. Thank you, Ali. Can you hear me?
Very well. Thanks so much.
Excellent. Excellent. Thank you all for joining us today. As you will have seen from the press release, today we are announcing our progress towards the Covax facility's goal of securing 2 billion doses in 2021 for globally equitable distribution. I will say that our journey to the announcements today began literally within days of the release of the viral sequences in January. Vaccine development began very quickly. It has progressed at a remarkable pace with the first approvals of vaccine within 326 days, less than a year from the release of the viral sequences. The Covax facility was established in April and May. We have been developing the facility since that time. Today we announced
Can we please get yourselves on mute, please? Richard, sorry.
Thank you. Today we have announced through a set of agreements, and we're so pleased to have the CEOs with us to talk about those agreements, securing access to nearly 2 billion doses of vaccine in 2021 and 2022. And through agreements that we have, through the Covax R&D agreements, we have also secured first right of refusal of more than 1 billion doses of vaccine that could become available in 2021, certainly contingent upon regulatory success. So we have built out a portfolio of vaccines that we have supported the development of. We are now engaging with vaccine manufacturers from around the world. And today we are very pleased to be able to announce great progress towards our goal. Science has given us the tools to fight the pandemic, but equitable access is what will enable us to win and to defeat the pandemic. What we see today with Covax, which is the only global solution to this pandemic, is all of the elements coming together to enable us to defeat this pandemic. I will, in the interest of time, I'd like to turn this over to Minister Gould, who will talk about the principles for vaccine donation, which will also further extend the number of doses that will become available through the Covax facility in the coming year. Thank you.
Minister Gould.
Great, thank you. Well, good morning, and thank you for this opportunity to join you from Canada. The images of the first vaccinations this week have brought us all hope. There is a light at the end of the tunnel, but we can't let it dim for some countries. Because as long as one country is at risk, we are all at risk. Collectively, we need to make sure that all countries are able to roll out COVID-19 vaccines to immunize their health workers and their highest risk populations as soon as possible. And the news that we just heard from Richard is very encouraging. And as we know, this is not about slowing some down, but about speeding everyone up. For this, Covax is our best hope. Yes, it carries risks, but so do all of our efforts right now. And now is not the time to be timid. We are going to be undertaking the largest vaccination campaign in the history of the world. And that requires boldness. That requires trying new approaches. Covax is the kind of response that we need. It is bold, it is unprecedented, it is global, and it is already up and running. And the strength of the Covax facility is its participants and partners. All of the participating countries, civil society organizations, the vaccine industry, WHO, UNICEF, scientists, and so many more. Together with the same vision of protecting everyone, everywhere. Covax is our best shot to make sure that our collective purchasing power drives manufacturing to scale. It's our best chance to ensure that the doses we procure collectively are distributed fairly and transparently. Donors around the world have already contributed $2.4 billion to accelerate access to safe and early doses of COVID-19 vaccines for all countries. While more is needed, this is a really good start. But we know that just buying the vaccines alone isn't enough. They need to reach around the world, be distributed to communities, and provided to healthcare workers equipped to deliver them. We need to support distribution that strengthens health systems and reaches those most in need. Thankfully, we have the right team for this challenge. That is why, as part of Canada's announcement on Monday of $485 million in additional support for the ACT Accelerator, $75 million will go to Gavi. That includes up to $5 million to build the Covax exchange platform, to efficiently manage vaccine sharing, and to ensure that every dose that is produced gets used. The COVID-19 pandemic will only be overcome when we come together around the world and make sure that no one is left behind. The time is now. We must all roll up our sleeves and work to make Covax a success. You can count on Canada to continue to be a trusted partner in this global effort. Our collective health and our collective prosperity depend on it.
Thank you so much, Madam Minister. And I believe we have Dr. Tedros back on. Dr. Tedros, over to you, sir. And I'm afraid we're still having trouble with the audio. I'm afraid we've lost Dr. Tedros again.
Ali, could you please ask James to unmute? The host can do that. I think this is a central unmuting is what he said. So
I believe we were trying to do that. Let's try one more time. In the meantime, do we have you, Dr. Tedros? I believe it's technical. I believe it's a technical difficulty. We'll try to get Dr. Tedros back. I must just say, dude, please.
Can you hear me?
I can hear you, Tedros.
Yes, we've got you.
Okay, so sorry for the technical glitch. Thank you very much. Thank you, Seth, for facilitating. I think he found out the problem. Thank you, Seth. Good morning, good afternoon, and good evening. From the beginning of the pandemic, we knew that we would need vaccines to end it. But we also knew that without concerted action, there was a risk that low-income countries would miss out on vaccines once they arrived. That's why in April, together with partners including Gavi, CEPI, UNICEF, WHO established the Access to COVID-19 Tools Accelerator, which includes Covax. Today, we're proud to announce that Covax has secured to access almost 2 billion doses of several promising vaccine candidates. These unprecedented agreements mean that all 190 countries and economies participating in Covax will be able to access vaccines to protect vulnerable groups in their populations during the first half of next year. This is fantastic news and a milestone in global health. I would like to thank and congratulate all our partners in Covax, as well as Astrazeneca, Johnson & Johnson, and the Serum Institute of India for their efforts so far. Images of people receiving vaccines are giving us hope, but it must be hope for all, not hope for some. For most of the past year, we have been talking to world leaders and vaccine developers to ensure that once vaccines were available, they were available equitably to all countries. Just this week, I have spoken with CEOs of pharmaceutical companies and met with European Commission President Ursula von der Leyen in Brussels to discuss this urgent moral, economic, and public health imperative. WHO and our Covax partners are working non-stop to start vaccination early next year. Same time, our message to all countries is that vaccines will complement, not replace, the existing effective tools we have for suppressing transmission and saving lives. This is a time for taking comfort that the end of the pandemic is in sight, but taking care that we do not let down our guard. We're all responsible for taking the measures to keep ourselves and each other safe, including during this holiday season. With today's news, the light at the end of the tunnel has grown a little bit brighter, but we're not there yet, and we will only get there together. And I would like to use this opportunity to thank Canada for today's announcement. Thank you, Canada, and thank you also to all other colleagues who have joined today. Thank you.
Thank you so much, Dr. Tedros. A quick request to our friends in the media to please turn your video off if you're not speaking. It may help us stabilize the sound. Now, Ambassador Seydoux, I believe also you have an announcement from France.
Well, thank you very much. And thank you for this very exciting event, which gives France an opportunity to recall the support that we've given to ACTA, the Access to COVID Tools Accelerated from the beginning, a support which has been both political, financial, as well as hopefully in the future now in kind. Now, our country has been strongly committed since the launch of the ACT Accelerator, together with Dr. Tedros, the Director General of WHO, aiming at guaranteeing equitable and universal access to the tools developed to fight the COVID-19 pandemic, tests, the treatments, the vaccines, as well as the health system strengthening. And France contributed to ACTA to up to 560 million euros. We welcome the progress accomplished so far in accelerating necessary innovations. Regarding vaccines, international efforts have allowed for an unprecedented response in terms of efficiency and speed. That's been evidenced by the deployment of the first vaccination campaigns in some countries. Covax has played a very important role in this, as recalled by Dr. Hatchett and Dr. Tedros. We are reaching now the moment of truth to ensure equitable access to this vital tool to fight against the pandemic. The French President, Emmanuel Macron, has advocated repeatedly for the vaccine to be made a public common good. Public in particular, this implies that those requiring priority access to the vaccine be indeed given priority regardless of their level of income, including those most vulnerable, those in need of humanitarian aid. This is why France supports actions taken to that effect, specifically by the Covax facility, in close link with WHO, in order to prepare the allocation of negotiated vaccine doses and their distribution to interested countries. Contributed 100 million euros to the advanced market commitment, adding to the 500 million euros given by the European Union. The French government welcomes today's great results presented by the previous distinguished speakers. We're particularly thrilled with the publication of the principles for sharing COVID-19 vaccine doses. And this follows up our President's call encouraging donations at the Paris Peace Forum in November. Now, those principles will guarantee the transparency and efficiency of the allocation of donated doses according to WHO guidelines, taking into account country preparedness. They will also provide logistical and legal security. This will be done particularly with the welcome help from Canada, and thank you for your leadership, Minister. France will rely on this framework to consider sharing doses as early as possible to enable vaccination against COVID-19 for priority populations in developing countries. We're confident that our European partners, who are also actively considering donations, will find these guidelines useful, and we encourage other countries to follow suit, particularly those belonging to the G7 and G20, as Canada has done. Sharing doses will express our solidarity with all countries affected by COVID-19. Solidarity is an essential condition to achieve collective victory over the pandemic. Thank you.
Thank you, Madam Ambassador, and those sharing, of course, a very, very important pathway for us as we seek to reach our goal. I'm going to turn now to Pascal Soriot, Chief Executive Officer of Astrazeneca. Welcome,
Thank
sir.
you, Oli. It's really great. Yeah, thanks, Oli. Can you hear me?
Yes, very well.
Great. Good. It's great to be here. Thank you so much. And it's also great to be here and join Paul from J&J and Adar from Serum Institute because we are all working very hard across industry to bring a solution to this terrible pandemic. What is so energizing about the Covax is that we have a shared ambition to ensure that the world has access to safe, effective, and affordable vaccines, which are distributed in a timely and equitable manner. I'm really delighted that today AstraZeneca has concluded this agreement with Gavi to supply 170 million doses of our Oxford AstraZeneca vaccine to the Covax facility at no profit. Through this agreement, we are enabling access to our vaccine to 190 countries around the world, should it be approved. I'm also pleased that the Serum Institute of India, one of our key licensing partners, is providing additional volumes to Covax. Together, we'll be providing hundreds of millions of doses of our vaccine, which will be fairly allocated and distributed to those who are most in need. Importantly, our vaccine can be stored and transported at refrigerated conditions, and it can be administered within existing healthcare settings. This is really important everywhere, but critical for countries with more limited infrastructure. Our Covax collaboration is a core pillar of AstraZeneca's equitable access strategy. Our ambition is to bring up to 3 billion doses of our vaccine to the world in 2021 at no profit during the pandemic period, with about 2/3 of this volume going to low and middle income countries. So we continue to work tirelessly with our partners and other companies across the pharmaceutical industry to deliver on this shared commitment. It's vital for communities, healthcare system, and importantly also for economies to return to normalcy. So it will take more than one vaccine to defeat the pandemic, and no one is safe until we are all safe. We've all said it, but it's really important. So thank you again to our Covax partners for their continued and shared dedication to this cause.
Thank you so much, Pascal. And again, please, a request, turn off your video if you're a member of the media, you're not speaking, and please keep yourself on mute. It's very, very difficult for us to control sound from here. Thanks so much. Paul Stoffels, we'll go to you next from Johnson & Johnson.
Good morning, good afternoon, and thank you for having us. We are also very pleased today to announce that we have reached an agreement with Covax in order to deliver 200 million vaccines this year and more in 2022. We are in the later stage of development at the moment, reaching the endpoint in a large clinical trial, probably the end of January. Following that, with regulatory approvals, we hope to be delivering vaccines in the course of next year on a very large scale. As said, we also have a single-dose vaccine that is going to be very important for large-scale implementation, and we are aiming to produce up to 1 billion of those vaccines in the course of next year. They can be stored at 2 to 8 Celsius for 3 months, but for longer time we store at -20, and that accommodates large distribution across the world. We also have told since long that we do this not for profit in order to make it vaccines as broadly and as widely accessible. We have made this commitment of a total of 500 million at the UN General Assembly in September to make sure that we start producing, to make sure that we start preparing access as soon as possible across the world. And we will be working with the WHO on the pre-qualification as soon as we can based on the regulatory approvals, hopefully early next year. We also appreciate very much the establishment of Covax, a vehicle which will absolutely allow to get vaccines into more than 190 countries worldwide on a very quick and equitable basis. Our focus is, as stated, we want to focus on first making sure the most vulnerable people are vaccinated in the world, and follow that, hopefully, the broad vaccination to make sure that pandemic we can leave behind us. So thank you all to the Covax, to the WHO organization, to Gavi, and especially Seth Berkley for making this all happen. Thank you very much.
Thank you, sir. And we'll go straight over to Adar Poonawalla, Chief Executive Officer of Serum Institute of India, a very, very important manufacturer with a long heritage of working with Gavi. Adar, over to you.
Good morning and good afternoon to all of you. It was really nice to hear what Pascal and Paul also have committed to Covax. And I must thank Seth Berkley and his commitment with Gavi that we've been working for many, many decades. In fact, providing from SII affordable vaccines to the poorest nations to ensure equitable access, for the children who might not have been able to get access to these vaccines. So, we went on to partnering with Astrazeneca at the beginning of this pandemic. And thanks to Pascal's support and the work that we've done with AstraZeneca and also with Novavax, we were happy to sign early commitments of 200 million doses with Covax at a very special price of $3, with also further options that Covax has the right to first refusal to put onto us for another further 900 million doses, which we look forward to supplying and committing as well. As we look at all these vaccines being made available, I'm sure we'll have to decide which vaccines will be most effective to different age groups and different ethnicities. But at the moment, we're seeing these early vaccines from Johnson & Johnson and Novavax and AstraZeneca, which we feel will be the most affordable and accessible. And I hope that through the efforts of Covax, and I must thank WHO as well for all their support, and UNICEF to make all this happen. So we look forward to performing now on delivering all these large volumes. Thank you.
Thank you so much, Azar. And I appreciate that you have to leave us at 2:30 European time. So thanks so much for finding time in your schedule to join us today. And next I want to turn to Henrietta Fore. Henrietta, you're joining us from California. Just invite you to make some remarks on the work that UNICEF is performing as a key partner in the Covax pillar.
Thank you very much, Ollie, and good morning. As we prepare to turn the calendar on what has been one of the darkest years imaginable, today we do pause to recognize that there is light at the end of this tunnel. Today's announcement is the latest positive momentum in our shared objective to ensure that this light shines for everyone. At UNICEF, we are ready. We are bringing the full weight of our experience as the world's single largest procurer of vaccines for children to help secure and deliver COVID-19 vaccines and to help countries to prepare, to receive, and to administer them. So here's doing this. We're working with PAHO, and we have launched a tender to purchase and deliver vaccines to 92 low and lower middle income economies who are participating in the Covax facility. The first supply agreements are expected to be signed in early January, which will allow UNICEF to procure doses just as soon as they receive approval from WHO. In addition to securing the vaccine doses, UNICEF has already pre-positioned more than 500 million syringes and purchasing 5 million safety boxes so that the used syringes and needles can be disposed of in a safe manner by health workers. To be ready and efficient for deployment of the vaccines, we are bundling the syringes and the safety boxes. And we have expanded our storage capacity in our new global logistics hubs in Copenhagen, Dubai, Shanghai, to support the COVID-19 vaccine. Working with airlines, freight providers, and organizations such as IATA and WEF. And once the vaccines are available, we are preparing to transport up to 850 tons of COVID-19 vaccines per month next year. This is more than double the average weight of vaccines that UNICEF currently transports each month. Working with WHO and Gavi, we are helping countries to prepare and to develop national deployment and vaccination plans for large-scale rollout of the vaccines. For example, to fill the gaps in the cold chain capacity, we are procuring and helping to install 70,000 cold chain fridges in lower-income countries by the end of 2021. This is part of a program which began in 2017 with the support of Gavi. So working with governments on the ground, we are working to strengthen cold and supply chains, to train healthcare workers, and to build trust in vaccines. Working with WHO, Gavi, and NGOs to design and operationalize access of COVID-19 vaccines in humanitarian settings. So in conclusion, this is a mammoth challenge. The stakes are incredibly high, but we are ready. Thank you, Ollie.
Thank you so much, Henry. It's an absolutely massive undertaking, and its work is beginning and it's going very, very well. Next to Soumya Swaminathan, Chief Scientist, WHO. Soumya, please, an update on allocation and regulation. And please remember to mute yourselves, everybody.
Thank you very much. Good day to everyone. I'd just like to add a few points to what my esteemed colleagues and speakers have already said. I would like to emphasize that although vaccine development for COVID-19 has been achieved in record time, the standard regulatory processes have not cut any corners. People around the world can be assured that the mechanisms for evaluating them have been robust, evidence-based, and scientifically sound. The WHO put out very early on the target product profiles for what an ideal vaccine candidate would look like, and we also have our criteria for emergency use listing on our website. I'd also like to point out that the scrutiny of the vaccines does not stop at the point where interim results are produced. We will continue to watch the vaccines for both safety as well as effectiveness, and we will continue to monitor those who have been vaccinated in countries around the world. These are the normal processes of good regulation, and they're going to be completely complied with this time around as well. WHO and partners will also issue periodic updates to recommendations for vaccine use as additional vaccines become available. Our strategic advisory group of experts on immunization, the SAGE, is the policy-making body, and they will be meeting very soon to start making recommendations on specific vaccines as their dossiers become available to the WHO. The next task, of course, and everyone has mentioned it, is to ensure fair and equitable allocation. Countries have been asked to develop plans that specify which priority populations they plan to vaccinate. The WHO, through SAGE, has also issued recommendations for prioritization of populations, as well as a values framework that can help countries as they're making these plans. All countries should be, and I'm sure would be, interested in first vaccinating those at highest priority for protection and those most at risk, thus maximizing the impact of limited initial vaccine supplies. We must protect the most vulnerable. The WHO has developed a fair allocation mechanism that will work hand in hand with the Covax facility to ensure that as doses come into the facility, they are equitably distributed to countries that are part of the Covax. The end to this pandemic can only come through a fair, equitable, and rapid allocation of one of our most precious global public resources. Thank you.
Thank you so much, Soumya. Seth, over to you, please. Your reflections on the collaboration to date and possibly a look ahead to the priorities of 2021.
So thank you, Ali, and I want to thank all of our friends in the media for joining us here today. You've now heard from my colleagues on the panel, and I'm sure all of you are ready to ask questions, so I don't want to keep you much longer. The main message I'd like to make is that our goal of global equitable access to COVID-19 vaccines is alive and well. We've all read reports in the media, some of you are on this call today, that Covax needs to secure more doses or hasn't raised enough money. We still need more doses. And yes, we still need more money, but we have a clear pathway to securing the initial 2 billion doses, and then beyond that, that we need to end the acute stage of this pandemic. I want to thank the partners in the pharmaceutical industry that share our vision. We have secured access to the initial 2 billion doses of vaccines, but as you heard from Richard, with many more under consideration. These will begin to be delivered in the first quarter of next year. And as you have read, we aim to fulfill our first tranche to protect high-risk groups such as healthcare workers by the end of June, before ramping up significantly towards our goal of 20% by the end of the year. Our supply of doses does not end there. Today, we published principles on dose sharing to allow some countries to share doses from their bilateral agreements with the Covax facility. You've heard about that from the minister from Canada and the global ambassador from France. This will allow us to access even more doses even sooner. So today, we have a clearer picture than ever on the global demand for COVID-19 vaccines. Of the 92 economies eligible for support from the Gavi Covax AMC, we have now received very detailed vaccine requests from 85 of them. This again will enable us to be as targeted and effective as possible in the procurements we make. And we continue to raise much needed funds to drive the AMC forward. It was just a month ago that we announced that the AMC had met its initial and urgent 2020 funding requirement of $2 billion. Today, that figure stands at $2.4 billion. I don't need to tell you that we still need more, not just the at least 4.6 billion more for the Covax AMC, but a further 800 million for research and development of second generation vaccines, as well as 1.4 billion for delivery support. COVAX mission is just beginning. Its success next year will depend not just on the ability to grow the portfolio or raise necessary funding, but on the readiness of countries it will serve to deliver the vaccines. Here, an enormous amount has been done already, but this will continue to be an area of focus now and into early 2021. But as we move forward, everything that has been achieved so far in less than a year, the 190 economies who have come together in global solidarity, the speed at which innovation has brought us promising vaccine candidates, the tireless work of all the partners, individuals, and communities involved should give us hope. And a global response is what we need. We are only safe once we are all safe. I'll leave my remarks there, but before I hand back to Ali, I'd like to thank you once again for joining us today. And I'm looking forward, as are my fellow panelists, to answering any questions you may have.
Thank you so much, Seth, and thank you to all my panelists today. So let's go to some questions. I believe we've lost Pascal. Pascal is in Australia, remember, it's very late. So unfortunately, he won't be here for any questions, but the rest of the panel is still here. I think three, the first three. Oh, you're here, Pascal.
I'm still here only for yeah.
Wonderful.
I'm still here for another 10 minutes. I have to go to another meeting after that.
My goodness me. Okay, thanks so much. Great to have you still with us. Okay, let's take three, please. Jamil, Chad, we have Simon and Esmir Milovic, please. Let's take your questions, and then we'll move on to as many as we can get through. Jamil.
Yes, Oliver, good to see you. Quick question. I'm a journalist from Brazil. My question is to Pascal, basically whether you have any idea when vaccination could start with your vaccine in Brazil, either inside COVAX or bilaterally, because you do have an agreement. And on the funding, if you may, Oliver, the 6 billion, where will this money come from? Thank you.
Thanks, Jamil. And we'll take Simon next, please. Jamil, please get back on mute.
Yeah, thank you for taking the question. This is Simon Atiba from Today News Africa in Washington, D.C. Last week, we know that an African-American expert who was on the panel that approved the Pfizer vaccine noted that there was not enough information for Black and brown people. So I would like to know if the Covax vaccine, Johnson & Johnson and Astrazeneca, if they have enough data on how the vaccine reacts on Black people around the world, especially people in Africa. Thank you.
Thanks so much. A great question as well. We'll take one more. So Esmir, please, you're next.
Good morning. My question is basically going after what Dr. Berkeley has said. There is a lot of disinformation in the media, especially here in the region of the Western Balkans, and some media are claiming today that the vaccines for the region of Western Balkans will arrive only in May of this year. So what is your view when we could expect the first doses here in the region of Southern Europe? Thank you.
Thanks, Esmir. I can tell you that we're aiming to get our first deliveries in the first quarter of 2021. I'll ask Seth to expand upon that. Perhaps, Pascal, we'll go to you first. There's a question around your delivery vaccines in Brazil, and also a very good question about the amount of research on Black populations.
Yeah, thank you. The answer to the first question is we're working with Anvisa in Brazil to get approval as quickly as possible. And we have submitted our dossier to about 20 countries around the world on top of Europe, UK, etc. And, we hope to get approval in the course of January. As far as supply, the manufacturing is done by a local company called Fiocruz in Brazil that we are partnering with. And so as soon as they are ready to deliver the vaccine, the vaccinations will be able to start. So I think in the course of Q1, there will be no question we can start, probably February, something like this, depending on how quickly Fiocruz can manufacture. And the second question relative to diversity in our study, we have two programs. One is run by Oxford University, and the second is run by us, AstraZeneca in the US. So if we start with the Oxford program, it's made of 3 studies, actually. One in the UK, one in South Africa, where we have 2,000 volunteers. And of course, there are mostly Africans there. We have a study in Brazil with 10,000 volunteers. And Brazil, as we all know, is one of the most diverse countries in the world. So we have a great diversity of participants. And the AstraZeneca program is enrolling 30,000 volunteers in the US. And the target there is to recruit 13% of African Americans. So as you can see, we will have a great diversity of volunteers in our programs.
Ali, you're on mute.
Somebody muted me. Thanks so much. I will I'd also just like to ask Paul and Sumia to make brief comments there. We do have many questions to go through, so if you could keep your remarks brief, please, sir.
I want to make a quick comment on the Black and brown population in the world. We have a very significant focus on the diversity. We include, we have studies run in North America, South America, and South Africa. With that, we have a significant representation of people of African heritage and a very strong representation in our US study of African Americans in the US. But also Hispanic has been a significant focus, and elderly. So we have to make sure that the diversity of the population is represented around the world, but also for very specific groups in each of the regions. Thank you.
Thanks so much. Sumia, do you have anything to add?
Not much. I think this is important. We're just watching this with every candidate that's coming out. Obviously, children and pregnant women are the other two populations we're interested in, and we're looking forward to seeing plans from the companies on how they want, they're going to provide data on women of childbearing age, pregnant women, lactating women, and children.
Thank you so much. Seth, a couple of questions from you. One on the deliveries. Esme was making a point about the Western Balkans, but it's applicable to all over the world, really. Can you give some more clarity on our delivery schedule, and also some clarity on the funding that we need to do and how we intend to raise that money? Thank you.
Yeah. Thank you. So let me just start with the money. We'll continue to raise it from generous donors around the world, from the private sector, and also using innovative financing mechanisms. Our innovative financing facility for immunization, IFM, already has been able to use for well more than $1 billion of the funds raised so far. And so we're in the process of working with countries to try to make sure that these funds can come. One of the principles of the ACT Accelerator is, given the fact that we keep pumping money into economies to help the economies with the fiscal problems, that doesn't end the epidemic. What we need is to be investing in the new tools that are necessary to help countries control the infections. And so there is a discussion with the G7 and G20 that maybe this could be small slivers of the domestic packages for dealing with the consequences of the epidemic as a way to finance a lot of this work. In terms of the questions of arrivals, let me remind you that in terms of kind of the global vaccine candidates, there's only been one vaccine approved. We're still waiting for stringent regulatory approvals of a range of other products. We may hear another one today. We've also heard some countries have, individually provided approvals, but we haven't seen those at WHO yet, the data behind those. And so what we're rushing here is scaling up products along with the regulatory approvals and availability. So as Ali has said, we're aiming for first quarter rollouts of this, but it's going to depend upon three things: availability of vaccine, obviously, and availability of of regulatory approvals for those vaccines. And then last and critical is going to be country readiness. That combination of three things is what is going to allow us to move forward in all of the countries of the world. And as soon as we have more information, we will make that available as the data comes out in terms of the production for the vaccines, licensing, et cetera. Over.
Thanks, Stefan. And a very, very good point there. Country readiness is key. We can raise all the money and get all the doses we need, but we need to be able to deliver them at the country level. Okay, moving on now. Next three, we have Matt, we have Carmen, and we have Jovic. Apologies if I mispronounced your name, Jovic. Matt, you first.
Hey, it's Matt Apuzzo from the New York Times. I just wanted to know, given the global attention that has gone into this, can we see the contracts that you guys have cut with the pharmaceutical companies, and would also be really helpful to see the individual agreements that have been made with the countries, both on pricing and on the terms of all of those deals. Right now, it seems a little bit like a black box.
Thanks, Matt. Carmen?
Yes, hi. Thank you so much for giving me the floor. This is Carmen Palm from Politico. I have a few questions. So I guess that one of the obvious questions is, what about any agreements with Pfizer and Moderna, which seems to be, the first one to get approval in a few countries, Pfizer and Moderna, I guess, about to. And I wanted to ask Canadian Minister Gold and the French ambassador for global health, are your countries ready to donate doses before all your population is vaccinated? Like, for example, right after you have vaccinated your priority populations, or at what point will, your countries be ready to donate those doses? I saw that J&J has applied for approval in South Africa, and I just wanted to check with Dr. Posthoffels if that is correct. And for Mrs. Henrietta Ford, she talked about the effort with PAHO for the bid, which I understand has a deadline of December 23rd. I wanted to understand, how does that work in the context of Covax? So is it other vaccine manufacturers that are going to come and participate in the bid, or how does that exactly work? Thank you so much.
Thanks, Carl. That's quite a list. Okay, Jovic, we'll try to get you as well and bring these all together.
Good morning. I just want to know how the 2 billion doses will be distributed to the 190 countries who have signed up for Covax. Will this be divided equally, or will the rollout depend on the number of priority recipients in a particular country, such as our healthcare workers? And also, now that Covax has secured the initial doses, what do you expect governments to do from today? Thank you.
Okay, so there's a good list of questions there. We have the allocation of doses. Perhaps, Sumia, you could answer that one. Then Henrietta, if I could maybe ask you to talk to the PAHO one, and then we'll take it from there. So Sumia, how are we going to allocate these doses that we've now secured?
Yes, I think that's a really important question, and WHO has been working with our member states on an allocation framework and a mechanism, and it's been agreed that in the first year, when we have limited supplies, that there should be equal distribution amongst all the countries that are participating in COVAX. So as vaccine doses become available, we would distribute them by tranches based on the percentage of their population. Understanding that most countries have prioritized their health workers and frontline workers and social care workers, which normally constitute 2 to 3% of the population. So doses to cover that population would be given first, then moving progressively up to cover 20% of the country's population. That should really take care of all the vulnerable and high-risk groups within that population, within the country. So that's the principle on which this is based. Beyond that, as more volumes become available, then of course we can rapidly scale up depending on the country's demands and availability of doses to cover as much of the population as the country would like to do. And the other question that's related is, what should governments be doing now to prepare? I think it's really important that governments need to do a number of things, including having a national vaccine deployment plan, informing their population and their communities as to how vaccination is going to be rolled out, who the priority groups are, training healthcare workers, making sure they have the cold chain and the supply chains and the data systems in place, ensuring that they have the legal mechanisms in place to provide indemnification to countries, making sure that there's regulatory approvals that can happen rapidly after a WHO emergency use listing or a pre-qualification. So there are a number of elements we're discussing with member states on a regular basis so that countries are prepared. So there's no time lost between arrival of doses in the facility, getting them into countries, and most importantly, into people. Over, Ollie.
Thank you, Celia. So, Henrietta, maybe we get to you next. So the question was around the PAHO deadline. I believe Carmen mentioned December 23rd.
Yes, and that's correct. And so, Carmen, the bid is open to all manufacturers, but when we come to agreements with manufacturers, we'll then hope to turn these into Covax advanced purchase agreements. And we will use it to also inform our Covax supply tenders in the future. It's the chain that one has to keep in mind. So we need the vaccines first, and then we need the vaccines to all be approved. Then we need to allocate them. Then we need the countries to be ready. And then we need the funding. So we're trying to do this all at the same time. But from a supply chain point of view, that's our mission.
Thanks so much. Paul, if you may, a brief answer on the approval process in South Africa.
Yeah, we do rolling submissions in many countries at the moment where we submit already data, both from what we have preclinical, clinical, but also from CMC, from the manufacturing, so that by the time we come with the study data, that 80% of the data is already with the authorities, and so they can review. And that's what they call rolling submissions. So in many countries around the world, you will see that we are already working with authorities to submit the data to go fast once the clinical data are there. So that's why we apply for already, while we don't have final data for approvals.
Excellent, that's great. Short answers are very, very much appreciated. We try to get as many questions as possible here. Ambassador Seydoux, Minister Gould, questions on the speed and the cadence of the donations that you've been talking about, and for which we're very grateful. Minister Gould, perhaps you first.
Sure, thank you. And I'm pleased to confirm that just last night our Prime Minister confirmed that we would absolutely be donating any excess capacity that Canada has. However, we will be taking it one day at a time. I'm sure, as everyone recognizes, we have approvals in Canada for just one vaccine at the moment. Those doses are just starting to arrive. However, with today's announcement and Canada's commitment to the AMC, as well as creating this governance structure for donating and sharing vaccines around the world and doses, we're making sure that the world is ready when that capacity comes online so that we can ensure that everyone everywhere is vaccinated in a timely fashion.
Thank you so much, Madam Minister. Stephanie.
Yes, absolutely. Same idea here. The idea would be really to start sharing vaccines as early as possible. This is what we're considering. And actually, in Europe, we are dependent on the European Medicines Agency's authorizations. So that's what is keeping us obviously very, what we'd need to respect. But the idea would be to start rolling out the donations as early as possible in conformity with the sharing principles which Covax and the WHO have issued today.
Thank you so much indeed. So 2 more questions left. Richard Hatchett, I'm going to ask you to comment on Pfizer and Moderna, and Seth, perhaps if you could give us some kind of insights into the issue of transparency and the black box that Matt refers to. Richard, over to you first.
Well, so we're certainly in discussions with Pfizer and Moderna. We're hoping to be able to reach agreements with them, but we were not ready this morning, so we were not able, obviously, to make any announcements. Just, I would say, watch that space. We have certainly tracked their progress as vaccine candidates, and they've done a remarkable job.
Thanks so much, Seth.
I just want to add to that, if I can, Ali, which is we are looking at all vaccines. So I don't want to just talk about those. any vaccine in the world is potentially eligible to be part of the Covax facility. Of course, we will look for transparency in data, safety and efficacy information. And then most importantly, we're going to want to make sure we balance the portfolio with a range of candidates that have attractive characteristics. And so, today we talked about a single dose vaccine as an important characteristic for many countries. As other vaccines come along that have characteristics, they will be considered compared to the whole portfolio. In terms of the questions on transparency, Matt, we have on our website posted the language for the individual agreements with countries, which is one of the questions you've asked for. In terms of the individual agreements with manufacturers, that is proprietary information and not something that we're planning on sharing, given the nature of those types of commercial and legal agreements. Over.
Thank you, Seth. Right, so we'll try to get one more round in by the look of it. So Christophe Hitayezu, somebody from AFP, I'm looking forward to finding out what your name is, and Jamie Keaton. Christophe, you first.
Thank you so much. We know Africa needs at least 2 billion doses that can cost over 12 billion US dollars. So as this pandemic has affected all the countries, even rich country need vaccine. So means Africa risk to wait longer. What's the WHO's plans or their partners' plans for Africa to help the continent get vaccinate their population in the early next year as it is for other part of the world? Thank you.
Thank you, Christophe. Of course, Covax was set up to avoid the situation you just mentioned, but we will definitely talk to that one. Can we have AFP, please? Whoever you are, please give us your name as well as your affiliation.
Yes, hello everybody. Good morning, good afternoon. My name is Agnès Pedrero. I'm working for Agence France Presse, AFP in Geneva. And I have a question to Gavi or WHO. It's about the money and the number of doses. On the doses, you say that almost 2 billion doses have been secured. What does mean secured? Does it mean that they have already been paid, or it's still going to need to be paid? And on the money, could you summarize saying how many money do you have already received and how many do you need globally? Thank you.
Thanks, Andy. Good questions. We can come to those. Jamie, let's try to get you in as well.
Thank you, Ollie. Can you hear me?
We can hear you very well, Jamie. Remind us where you're from, please.
Press Geneva. Thank you very much. I just wanted to follow up on what Dr. Tedros said, and I'll just make sure, I don't think he's on there, but maybe Dr. Swaminathan or someone else can answer this. Just in terms of, he mentioned that that the agreements mean that you're going to be able to provide vaccines to protect vulnerable groups during the first half of next year. I hear vulnerable groups, and I think that's mainly healthcare workers, the elderly, and whatnot. Can you give us a more perspective as to the timetable we're looking at for mass vaccinations in these countries? And then the second question is for Dr. Hackett. Just in terms of, you mentioned about the Moderna and the Pfizer conversations. Could you just give us a little glimpse as to, what...
Jamie, you're breaking up quite a lot, my friend.
I'm sorry, can you hear me now?
Yeah, no, Richard, please repeat.
Okay, yeah, it's just about the talks with the vaccine makers that are farther ahead. Could you just give us a little insight as to what's the holdup there? Is it the logistical issues of cold chain? Is it the cost of the vaccines? Is it the fact that they're focused on U.S. regulators more? Could you just give us some insight as to what's holding those up? Thank you.
Yeah, thanks so much, Jamie. So let's tackle Christophe's question first around how can we avoid African nations and other lower income nations being pushed to the back of the queue. Of course, that is what Covax was set up to achieve, but I'd maybe invite Sumia to talk a little bit about that. Seth, a little bit perhaps on the status of those doses, the 2 billion, have they been paid for? I know the answer is no, but perhaps you could give some greater clarity there, and a little bit more again on the money we've received. So, Sumia, perhaps you on how to avoid Africa being pushed to the back of the line.
Yes, as you rightly said, all the Covax and the ACT Accelerator, in fact, was set up for two things. One was to accelerate the research and development of new tools, vaccines, therapeutics, and diagnostics. And the second goal right from the beginning was equitable access, exactly to avoid the situation that we've seen in the past, where there have been long gaps and delays between access in high-income countries and in low-income countries for many, many diseases and many health products. And so the whole goal of Covax is that we try to vaccinate people around the world at the same time, knowing, however, that supplies are going to be limited initially. We need to prioritize. We cannot go for mass vaccinations for day one. And the idea of prioritizing is to reduce the high death rate. So I think that's our top priority, bring down deaths, preventable deaths. The second is to protect health systems by protecting healthcare workers, because many countries are completely overwhelmed now. So the healthcare workers, if they're healthy, then the health systems will function much better. And then to enable countries to start opening up their economies and start the recovery process. And of course, as time goes on, we will need to do mass vaccinations as well. So the COVAX facility, by pooling the risk, by investing in many candidates, by pooling procurement, now has access to probably the world's largest portfolio of vaccines. And by doing that, we ensure not only that you are minimizing risk, because all vaccines may not succeed, as we've seen from the past. So you minimize risk.
All right, we've been broadcasting for an hour now a live UN COVAX launch. Well, COVAX is a facility to ensure equitable access to vaccines. And we've just heard that a vaccine has been researched on. However, the regulation on the development of the vaccine has not cut corners and was scientific and evidence-based. So those who have been vaccinated all over the world will be monitored closely, and there will be periodic updates on progress made on how they affect them to make recommendations to the development of other vaccines. So for those people who do not understand what we mean by vaccination, a simple definition is that a vaccine is a treatment, a medical treatment which makes the body stronger against an infection, a medical product that is injected in the bloodstream of a living being via a needle for the stimulation of a person's immune system so that they can produce immunity